For the wearable revolution, please welcome Tom Beauregard, Chief Innovation Officer of UnitedHealth Group, Dr. Rosalind Picard, Professor at MIT Media Lab and co-founder and Chief Scientist of Empatica, and Dr. John Moore, the Medical Director at Fitbit. Leading the conversation, please welcome Stat Editor Patrick Skerrett.
Hello, and thank you for sticking with us this afternoon. I appreciate your being here for this panel on wearables. I was really excited to be asked to moderate it. I've been an early adopter of wearables in 5th grade. I got my first wearable. That was before Elvis Costello made the black plastic frames cool. I used pedometers early. I monitor my steps and my sleep with a watch. And I was diagnosed a few years ago with a late onset type 1 diabetes. And for that, I use a glucose sensor, which tells me whenever I need to look at it what my blood sugar is, which has made a huge, a huge impact in the way that I deal with type 1 diabetes. So wearables are both cool and really effective, and I think we've got a panel here that can talk about both the cool and the effective part of it. I'm curious about others' adoption of wearables. If you use just one wearable, please raise your hand. Okay, how about 2? Do I hear 3? Okay, but that kind of engagement shows it really gives some credence to estimates like Gartner Group, which estimated that this year 300 million units of wearables will be shipped and sold worldwide. That's a lot of wearables. They've come a long way. John, I wanted to ask you, your company's name, Fitbit, has become pretty synonymous with fitness trackers. Could you tell us how these things have changed and how they're evolving?
Sure. So some of it follows the path that you started with originally just tracking your steps and maybe the number of stairs that you climbed, evolving to be smart enough to automatically detect which activities you're doing, running, treadmill, elliptical, hiking, etc., and then adding additional sensors to measure your heart rate, not just measure your heart rate, but measure it resting while you're sleeping and compare that to your activity to get a level of your cardiac fitness, and then eventually to be able to figure out your sleep stages. Now we're doing things such as correlating what's happening with your activity with your sleep. I exercised, I swam 15 minutes before going to sleep the other day, and the next morning it told me, hey, great that you're exercising, but if you do it so close to sleeping, take a look at your sleep stages, you could be affecting that. And now the new things that are happening are starting to work on new types of detection where we might be able to detect atrial fibrillation or sleep apnea or other conditions. And then the next step of evolution, Fitbit acquired my company, Twine Health, recently, and we bring together health coaching tools to then lend additional support to individuals who might have diabetes or hypertension or be working on weight loss to leverage the power of the wearable to inspire and help the person understand themselves better, and then add other capabilities for those people that need it at certain times to tackle chronic diseases and other conditions.
Tom, your company is investing in this fitness in wearables and fitness technology. Could you describe your moving program?
Yeah, we have a program called Motion, which is national at this point, and it's basically a platform that is device agnostic. So we offer people activity monitors. Fitbit's a partner, Apple Watch is a partner, but the basic premise is trying to motivate wellness and activity levels, intensity, frequency. And we've linked it to our insurance product, so all employers are eligible to offer this to their populations. And it's essentially, if individuals meet their goals, they accept the device and they meet their goals, then they get financial incentives. And it's almost $1,000 a year for the person that actually meets the goals, so they're substantial. We don't have clinical outcomes yet. It's early for that. But from a participation standpoint, it's been really popular. We have hundreds of thousands of members in. I think we've paid out $30 million in incentives across the program. I'll trigger a little bit off of what John described. I think a program like Motion is really important, and it's on the wellness side of the spectrum. But really where digital health connected models need to go is towards the 40% of the population that have chronic conditions. And that's where the idea of using FDA-approved devices, and sometimes that's an activity device, but much more advanced devices like a CGM or a Bluetooth-enabled inhaler for a kid with asthma. What we really need to get to are models for people that have chronic conditions where there's disease management occurring. And that's looking at their day-to-day results and then doing outreach as appropriate, either through the physician or through nurses like we have at Optum. But from my perspective, that's the real promise of digital health. It's trying to engage people that have chronic conditions, not just the folks that are sort of naturally interested in wellness and healthy.
And then on beyond wellness and fitness, Roz, your company, or one of your companies, just got FDA approval for a device that helps people get early warnings for seizures. Is that correct?
So Embrace it's able to measure activity and sleep, and it also measures other information that is, we're using it to build a stress sensor that's not released just yet. But right now, it just got FDA cleared, the first smartwatch cleared by the FDA for neurological use in detecting seizures. In particular, the most dangerous kinds of seizures, the generalized tonic-clonic that take a life every 7 to 9 minutes. This can send an alert and bring somebody there to stimulate the person and provide first aid and hopefully dramatically reduce those sudden unexpected deaths in epilepsy.
And are there other uses of this beyond that you're looking at?
Yes, we are, Empatica makes two wearables, the E4 and the Embrace. They both continuously collect clinical quality data. They're both medical devices in Europe, and Embrace is also FDA cleared, as I said. They are collecting data that is used right now for understanding the role of stress in health as a main unique factor that we have. So that is important, for example, in studies to forecast seizures, which we're not claiming to do yet, to forecast migraine, to forecast panic, anxiety attacks, and to understand interactions of stress with all kinds of health conditions. There's also a close coupling with depression. And at MIT, where I am also a full-time professor, we are doing lots of research on depression and helping people who are trying to prevent becoming depressed, or who have mild depression, or who have severe depression. And there we're already taking data from smartphones and wearables, and we're more than 0.8 correlated with the Hamilton Depression Rating Scale scores that doctors give.
So that we were talking backstage, there must be applications for things like PTSD and the military with this?
Yeah, I would imagine, and that's an area where we're focused, particularly in with the TRICARE population, the veterans. So yes.
Yeah. Your device and others probably are collecting data, lots of data, very personal, very intimate data all the time, and they're going away from our devices somewhere else. Reading about Cambridge Analytics and their ability to really hoover information from Facebook very quickly makes me a little nervous about our health data from our devices that we've given permission to collect from us going elsewhere. Is that a concern in the industry?
I would say it's something we have to learn about, right? I mean, it's one thing to track steps and motivate people from a wellness perspective. It's another when you're looking at, with a CGM or depression levels. And one sort of general point I'd make, we have a variety of studies going on in this space using FDA-approved devices, where we do have basically nurse teams looking at the data on a day-to-day basis and then doing outreach when there's an alarming pattern. What we're finding in the sort of early studies, and I said this backstage as well, if it's a parent who has a child with type 1 diabetes or asthma, those studies fill up very quickly. Parents want help and they're willing to sort of accept that kind of monitoring because it's real-time disease management. When it's adults, like a type 2 diabetic or another sort of chronic condition, we do find that the participation rates are a little bit lower. I mean, there's, I think, a different level of sort of focus when it's you versus your kid, and a different level of paranoia, for lack of a better word, in terms of how that data is being used, to your point. I also think what's really important is who's asking, right? And this is another area where we've got a lot of sort of studies underway. If it's your primary care physician who's coming forward and saying, hey, Tom, I know it's type 1 diabetes or type 2 diabetes, I can offer you this device, United will cover it, we'll look at the data, I can do outreach, versus whether it is an insurance company coming forward. And I think there are ways to do both, but we really have to understand how to engage consumers in this in a way where they trust that the data is being used to their benefit.
Are there ways besides cash to do that people are finding?
I hope so. I would say that just, it's basically, if you think about the way disease management works today, it's a pretty fragmented system. If I have diabetes, I might see an endocrinologist 3 or 4 times a year. Not a lot of data on the table, trying to rely on my memory in terms of how I felt. I think that's the biggest motivator for somebody who is actively trying to manage a disease. You'll get better care. I mean, behind the scenes, people will be looking at your data, and if there's an alarming instance occurring, then there's outreach.
Yeah, like an epilepsy, which is going to affect 1 in 26 Americans at some point in their life. The current gold standard is people self-reporting these seizures, and then the doctor sees how many you've reported and treats you based on that. It is known under controlled conditions, people are underreporting them by about 50%. So doctors, you may not even know that you're having life-threatening seizures at night because you're asleep, you're unconscious. And so now we are more than 99%. In FDA trials, we were 100% sensitive. And in real-world ambulatory, you can adjust it. Usually, we put it somewhere above 95%. So people can find out if these things are really happening and get treated in a way that's hopefully much more effective.
So it sounds like from your experience, the information you're collecting is not just helpful at the patient level, but it's helpful at the medical level, trying to figure out how does this disease work and how can it be treated. Is that right?
Yes, exactly. And we also think it's a really exciting time to help people understand what their behaviors are, back to John's behavior change, that are affecting your health. So a lot of moms will swear that, gosh, I think if my kid goes to bed early and gets regular exercise, he doesn't have seizures as frequently. Yeah. We can now get the data at the same time that we're getting the seizure counts, run those algorithms and see, wow, this is really true for these kids. Now we could take this evidence and use it to, suggest treatments for other people who look like that.
Yeah. And those same kind of insights, if you're talking about diabetes or hypertension, et cetera, being able to track someone's blood pressure correlated with their activity, with their sleep, with their medication adherence, gives you this incredible capability to help people become empowered to take a more active role in their care and make a difference there. But it also allows the caregivers on the other side to support them. But to your point, means that we really need to invest in privacy and security, and also be incredibly transparent with people about what's being shared with whom, so that they can make the right decisions about what they want to do with their data.
I think we also have to let people know that even if you think you can't be identified from, say, just your motion activity on your wrist, turns out now that when you're still, we can not only identify your heart rate and respiration from your motion activity while you think you're not moving, but we can identify you in small groups. So even data that you think doesn't have your name, address, or whatever on it can actually be used to identify you. So I think we need policy, too, about not re-identifying data that looks de-identified.
Yep.
You've just been through the whole FDA approval process, which is not a walk in the park, from what I've been told. What role does the FDA currently have in wearable devices, and what do you think it should be doing?
I think they're trying to be very reasonable in recognizing the difference between well-being and kind of just taking care of ourselves versus real medical claims. We had to go through FDA because we're trying to make real claims about detecting the most dangerous kinds of seizures. If we were just doing the Sleep and activity, as you know, those things are largely not regulated, although in some cases they are, and when you're submitting the data for clinical trials and all. So there's a lot of gray areas. What I would hope they would do in the future is, and we're working on this with them, is get away from the mindset of kind of a one-size-fits-all product. Right now, they really want fixed algorithms, fixed devices. We got the hardware and the algorithm approved. But at the same time, I can show that using our machine learning that we've developed both at Empatica and at MIT, that we could build customized algorithms based on your data that can do better for many people than the FDA-approved algorithm. So how do we deliver the best to people when, if you have to go through this non-walk in the park, as you put it, for every algorithm? So we're working with them to try to understand how to adapt things.
Yeah, I think that's an area where they're showing real forward-looking insight. Fitbit is one of 9 companies that's part of a new pre-cert program where it doesn't have anything to do with our devices or our algorithms, but just helping to create a new process for many other companies that will come in the future, particularly about creating software as a medical device. So those algorithms that are going to, by the time you get one approved, you've probably created the next one.
We've already made it better.
Right? So you want to be able to have an ever-evolving landscape of capabilities that helps people on the front lines. So I think there's a lot of forward-looking insight there about how this can be done in the future, where it will add new constraints about what you have to do after you go live and share a lot more data once you've already put this out into the world about how it's working and how it can improve, which I think is going to be pretty exciting.
Well, we'll take questions in just one second, so get your questions ready. I just have one more for the panel. We've heard a lot here today about the big chasm in health by race, by income. Will these devices help deepen the digital divide, or will they help fill it in?
I think they can really help fill it in. In my experience, some of my earliest research was with folks who had never graduated from high school, had never used a computer. And to them, it was something that made the healthcare system way more accessible to them. And they had a lot of strong things to say about how difficult it was to get access to care. And I know that there are many organizations out there looking towards subsidizing devices because the cost is so small compared to the benefit that can be gained. So I think it presents low-cost opportunity to provide really high-touch care to many people who need it.
Yeah, I would agree with that, and I think maybe more specifically you have to get the reimbursement to make sure that that doesn't exist, right? So whether that's in a commercial market, a Medicare market, a Medicaid market, and so the devices and the monitoring systems that have evidence and obviously FDA approval, they need to get reimbursed, right? Things scale in the healthcare system when they're paid for through the health insurance system. And we see that all the time. And if you think about sort of what this means, use my endocrinologist example from earlier, that endocrinologist who today is in a traditional kind of disease management model is seeing that diabetic 3 or 4 times a year, they might not need to, right? They might, because of the sort of the ability to monitor, have the data, do outreach. But as a system, we have to figure out how to pay for that, right? There's still time that's involved in that outreach, in evaluating the data. And that's easy in a sort of accountable care world where, but that we're not there yet. We're still sort of moving towards full risk with the provider community. And in that interim period, we have to find ways to compensate the docs basically for their time evaluating data and doing outreach. And I think the industry's ready to do that for FDA-approved devices that have strong evidence behind them.
Questions?
Hi, my name is Zach Orlov, and I need to monitor my sleep to get medications right. What form of wearable device or infrared would I want to use to get the most accurate sleep and sleep stage monitor?
Well, that's a heavily biased question, so I wouldn't want to answer that in any way that lends more credence to one company than another. I think that's something that what's really interesting is there we talk a lot about the FDA side of things, but this side around heart rate and activity and sleep, there are about 500 published articles about the impact without healthcare providers. And I'm very much a person who comes from the side of doing research in deeper diseases and healthcare. But I've been 5 weeks at Fitbit learning that there is so much research publishing about the impact that using these sensors on your own can have and your own feedback and making adjustments. And so the takeaway from that is online, you can find whole databases of research studies on wearables that will provide you unbiased information about impact in particular areas. And there's a lot of different articles about sleep and about which kind of sensors and where the accuracy is, about particular sleep stages or sleep in general.
I think that wraps it up. Thank you very much.